Test results usually take about 5 to 6 days to come back. So again, you can expect that we're going to continue to see cases reported throughout Acadiana. We don't want people to be alarmed, but we do want people to realize that now is the time to take those actions to prevent the further spread. So clearly this virus is present in our community, which we all suspected that it was, but what we don't want to see is sustained community transmission. And the only way that we can stop that, the only way, is for people to take responsibility, to follow the actions that our governor has so very clearly laid out, to avoid congregating. When you do have to go out and about in public, maintain the social distancing that you see demonstrated here. Those individuals who are most susceptible, people older than 80, should stay home if they can, but then all of us need to help those individuals and offer to grocery shop and go to the drugstore for them. So again, we know we all need to be out and about. Some people do still need to go into work, so if you do, follow those personal, those personal hygiene recommendations that we keep talking about. Keep your hands clean, away from your face, maintain distance. And again, don't panic, but realize that if we don't all take responsibility and follow those very simple guidelines, that we are going to see a continued spread in this parish that could eventually overwhelm our healthcare system, because 15 to 20% of people might seek medical attention or need hospitalization. So for most of us, very mild illness, but again, for those most vulnerable, it can be quite devastating. So again, now is the time to take action. Hopefully people will realize what we've been saying, all along, to take these measures, and these positive results that are now coming back will, I think, further reinforce that message. So that's it for me. Do you have any questions?
In this case, is there any indication as to how this person acquired the virus?
So we have a wonderful epidemiology staff. So our epidemiologists conduct very detailed case investigations. So we have all that information. We collect it as a state health department, but we don't share that information.
Can you give us any information about the person? Are they hospitalized? Are they quarantined? Can you tell us their condition? Are they in Iberia Parish?
So we don't want to give any information that could potentially lead to identification of a case, but we do know there's a lot of concern in the community. So in any community where we see cases, so what we can tell you is part of our investigation, when we talk to individuals, we give them their guidelines, which is isolation guidelines. So they need to remain isolated for a certain period of time, and we discuss that with them based on their symptoms and symptom onset. So we have no evidence that there's any concern for any individuals in Iberia Parish. As you would expect, we are pretty sure that there are more than one person in this community that has this virus. It's just we've been very limited on the individuals that we can test, because there's limitation of testing supplies nationally. So we should all assume, I think some of the best guidance that I've heard over the last couple of days is we should all act as though we might have this virus. Most people have very mild symptoms. Now there's even a question of asymptomatic spread. So the safest thing to do is just act as though you have this virus. Again, do the social distancing. Be very careful when you're around people who are most at risk, because as a result of the limited testing supply, we really don't know what the level of virus is in the community. But again, the best that we can do to keep the level low is to practice those safe distancing and again, good hand hygiene and respiratory hygiene.
Is it safe to say that the person who tested positive is self-quarantining?
So again, we don't give any. We don't give
Okay.
any of that information. But I can tell you again, our epidemiologist, we and I work very carefully and closely with all of these cases, and we're very. We all live in this community as well. We want to make sure that our community is protected, and the way that we do that is to be sure that these isolation guidelines are followed.
For these epidemiologists, how has it been trying to trace all of this? There's so many people, we're learning new people every day. I'm sure that's been a challenge.
Yes, she's at our office right now, making phone calls and on the phone. So it's a very tedious process, and we're very fortunate to have great epidemiologists here in Acadiana and around the state who've been working tirelessly over the last several weeks.
Would you say this case is connected to any other of the cases that are been reported in Acadiana?
So I can't say that.
Okay.
I can't answer that question.
How many tests have y'all conducted so far?
Oh, gosh. So hundreds at the state lab, the state public health lab, and hundreds, maybe more, through these commercial labs. There are new commercial labs coming online every day. So now it is very hard to keep up with the number, because your physicians, hospitals, walk-in clinics, urgent cares are also submitting tests that we don't know about until they come back positive. So we'll never be able to keep track of the number of tests that are submitted, but we do. All of the positive results come back to our state public health lab, and we report all positives. And I just want y'all to know that y'all have a great medical community here in Iberia Parish. You have a great hospital. Great parish leadership who has brought them into all of these discussions. And so we're very hopeful that your providers, your hospital, will be able to do more testing over the next couple of weeks. But again, that testing has been limited.
For those in Iberia Parish who would like to get tested, where would they go?
So ideally, anyone who has fever, respiratory symptoms would be tested for COVID-19. Unfortunately, again, there's been a limitation in testing supplies. So what most communities have decided is that individuals who are high risk, so people older than 60, people with high risk medical conditions, and have symptoms would then be tested. So in that case, if you're at home and you're in a high risk category, you have symptoms, you should call your healthcare provider and ask them if they have, if they're able to test for this virus. And then when you do come in, they're going to tell you you need to when you come in, immediately put on a mask, and then the healthcare providers have to put on their personal protective equipment in order to do the test or evaluate the patient.
So right now, are you all saying that only those high-risk groups that have fever or respiratory problems, those are the ones that would get tested?
So it just depends. It's a tricky question. It depends on the provider's supply of test kits. And so this is a commercial these are private labs. And so if one provider is able to secure a good number of testing supplies, then they can test anyone that walks through those doors. It's based on your clinical suspicion. So if a physician, nurse practitioner suspects that person might have this virus based on their symptoms, they can test anyone. It's just been at this point, most providers have limited to high-risk groups because they may only have 2 or 3, enough to do 2 or 3 patients in their clinics. But from all indications, our governor has been working really hard to secure more testing supplies or to drive those commercial tests to Louisiana. So what I've been hearing is that the testing supplies are greatly increasing this week.
Can people in Iberia Parish go get tested elsewhere, like let's say the Cajun Dome in Lafayette?
So I would say talk to your healthcare provider. The best link is for you as a patient to work through your healthcare provider, your typical healthcare provider. They know your risk factors. They know you. So I would say to people in Iberia Parish, talk to your local healthcare provider. That it's always best to seek care locally and through your provider.
And if you
and I will say that I think even providers locally will start to see we're all getting the kits at the same time. There's no prioritization, and so I do think in Iberia Parish your doctors, your clinics, your hospital will get more testing supplies over the next couple of days. But it's almost not even. The testing is great, and it's important for us in public health to know the level of virus that's out there in the community. But the test is not a rapid test. So it's not like the flu when you walk into a clinic and they do a swab and you know within 15 minutes if you have the flu. It does not work like that right now for this virus. We're hoping, we hear that there's a more rapid test, but we do not have access to that. So anyone that's tested, it takes about 5 or 6 days for that results to come back. So at that point, hopefully most people are doing better and have been isolating at home. So if you go to a doctor, they're not able to do the test, or if you call, they're going to say stay home, isolate yourself, protect everybody else in the household, limit interactions with them, and call. And if you get worse, then they're going to tell you to call them. But so for most people, couple of days, your symptoms are going to subside and you will be fine. So the testing at that point is really not that helpful. It's most helpful for people who are at high risk for us to know, because at 7 or 8 days is usually when the symptoms worsen if they're going to. So then at that point we know that person is positive, and then we know the provider will know that they need to really maintain close connections with that person to make sure that they're not getting worse.
And let's say you don't have a primary healthcare provider, what about going to a walk-in clinic and maybe letting them know your symptoms?
Yes, yep.
Okay.
So call ahead and again tell them. And again, all the clinics in this area are really trying to ramp up their testing supplies, and they're working very closely with their typical supplier. And I do think that you're going to see supplies increase.
We just found out Sean Payton had it, and all he was feeling was a little fatigue without showing a lot of other symptoms, but yet he was able to get tested. Is that an anomaly? Is that Sean Payton?
So I'm not sure. I can't, I guess, speak specifically to his case, but I will say we see the gambit. So mild people have very mild symptoms to more severe, and we also see people whose symptoms start out mild and then it progresses and it gets worse. So I can't speak to exactly what happened in that case.
probably can't say, but the patient who was tested positive, are they from Iberia Parish or were they?
So the way we report as a state, we report on parish or residents. And so this individual is a current resident of Iberia Parish. Anything else?
We're good.
Thank y'all. And thank you, Mr. Bishop.
Okay. First, I want to just thank the Iberia Parish Council. We have the chairman here, Eugene Olivier, for working so close with us and to try to get the things done that we're getting done. I want to thank the Acadiana Planning Commission for helping to put these meetings together that we've been having. We have one Monday, we have one today. We're going to have them every Monday and Thursday until this crisis is over. And the reason we're having these meetings is because we want to know what's going on in the region. We definitely want to know what's going on in Iberia Parish, but we want to know what's going on in the region. And we get a lot of information from that. So I want to make sure that I thank every parish president and every mayor and every sheriff and city police, and the list just goes on, to DH&H, Homeland Security, for attending these meetings with us. We're learning a lot. And with this case being present in Iberia Parish, I can assure you that there are a few other things that we're going to be doing in Iberia Parish to further try to help reduce the amount of cases that we have here. And with that said, if you have no more questions, I think we can adjourn this. Yes,
Well,
ma'am.
what would be some of those new measures?
Well, those measures we have to take up with the medical department, with the advice of our team that we have assembled. And once we figure out how we're going to handle that, then you know. I can't give it to you until I know. Thank you. Any other questions? Thank you.
Thank you.
All right.